Alright, you can go ahead and have a seat on the bed. I'm Cody. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Joshua Ward, 10/23/83.
Okay. Do you have any allergies or are you in any pain right now?
Nope.
Alright, so today I'm going to be doing a head-to-toe assessment on you. I've already completed your vital signs, so we won't be doing that. During this assessment, I'm going to ask you to lay down, sit up a good amount of times, and I'm also going to be touching you. Is that going to be okay?
That's fine.
Alright, do you know what today is?
Monday.
And do you know where we're at?
Hospital.
And do you know why we're here?
An assessment.
Okay, good. So, patient is alert and oriented times 4 to place, time, person, and situation. I noticed his posture was erect. His gait was steady while he was walking in here. And his affect is calm and cooperative. Alright, so I'm just going to be looking at your head, face, and neck right now. So, face is symmetrical. I don't see any drooping. Look inside the nose. Nose is patent. Can you say I? Alright. Oral mucosa is pink and moist. Uvula is midline and dentition is intact. I'm going to be feeling your ears. Any tenderness or pain? Nope. Okay, ears, there's no redness or tenderness or drainage bilaterally. And he's responding to spoken words, so hearing is intact. Alright, so I'm also going to be shining a light in your eye, so I'm going to cut these lights off for a second. Okay. Good. Can you look at that picture behind me? And then look at my pen. Good. So Perla is noted bilaterally. Pupils are equal, round, reactive, and to light and accommodation. Skin is also uniform to the rest of the body and appropriate for ethnicity. I don't see any lesions, no bruising or scars, and texture seems to be smooth. Skin is also warm and dry. Patient does have tattoos noted to the forearm and the bottom of the forearm. Alright, can you grip my hands? Good. Can you shrug your shoulders? And can you turn your head to there and then the other way? Alright, good. Grip strength was strong bilaterally and range of motion is intact. So now I'm going to be looking at the chest. For this purposes, my patient's going to leave his shirt on. In real life, I know that I will listen to all lung and heart sounds directly on the skin. Alright, so first for the heart sounds, there's 5. So we're going to listen to the apical pulse. I'm sorry, the aortic here, which is the right second intercostal space, and the pulmonic, which is the second left intercostal space. Erb's point, which is the third left intercostal space. The tricuspid, which is 4th left intercostal space, and the mitral, which is the 5th midclavicular left intercostal space. When I'm done listening to those 5 heart sounds, I'll also go back and listen to the apical pulse for a full minute. Alright, can you just turn and face the camera for me? Okay. Before I listen to your heart sounds, I'm going to feel for your carotid. Okay. Good. Carotids are palpable bilaterally and strong +2. I'm going to listen for a bruise. You hold your breath. Good. Hold your breath. Good. No bruise noted in the carotids. Alright. Alright. Okay, so now I'm going to listen to your apical pulse for a full minute. All right. Apical pulse was 80 beats per minute, which is within normal range of 60 to 100. I heard regular S1 and S2 sounds. No murmurs, no clicks or extra heart sounds heard in the 5 auscultatory areas. And chest, the skin on the chest is consistent with the rest of the body. I don't see any lesions, scarring, or bruising, and it seems to be smooth. So now I'm going to listen to the lung sounds. So I'm going to listen to your lung sounds on the front and then on the back, okay? When you feel my stethoscope, just take a deep breath. If you feel dizzy during this, just let me know. We'll take a break. All right. Good. All right, can you turn this way a little bit? Same thing. Okay, you can turn back around. Lung sounds were clear bilaterally, posterior and anterior, and they were clear. All right, so I'm gonna get you just to lay back for me. Can you turn your head this way? Okay. No jugular vein distension noticed at the 45 degrees. All right, so I'm gonna be doing an assessment of your abdomen. So I'm gonna lift your shirt up. Okay. The abdomen contour is symmetrical, doesn't seem to be distended. I don't see any lesions or scars, and color is consistent with the rest of the body. So I'm going to listen first. Now I listen for your vascular sound. All right. There was intermediate gurgling in all 4 quadrants, and no bruise heard when listening to the vascular sound. The gurgling would have been about 5 to 30 a minute. So his bowel sounds are active. Okay, now I'm going to palpate. You just let me know if you have any pain. Any pain? No? All right, no masses felt upon palpitation, or patient said he also didn't have any tenderness. Okay, I'm going to get you to sit up again for me. All right, so I'm looking over again the extremities. I don't see any pallor or cyanosis or edemas in upper or lower extremities. The temperature is warm and dry. All right, and I'm going to check your cap refill. Good, less than 3. And less than 3. All right, I'm also going to check your pulses. I'm going to check the radial pulse. Good, those are strong bilaterally, and then the brachial. Okay, we're going to do some range of motion. Can you do this? Good. Twist your wrists Wiggle your fingers. Okay, and then can you just do your arms in a circle? Good. Any pain with that? No? Patient's range of motion was intact. Alright. I'm going to get you to lay back again for me. Alright. Can you push up against my hand? Good. And this side? Good. We're going to rather use your legs to your chest. Any pain? Okay. Range of motion is intact in the lower extremities. For this purposes of the video, we also would not have checked for his femoral artery, which would have been right here, and the clonus effect, which would be I would have dorsal flexed his foot, and when I let go, it should have relaxed on its own. If there was any tremors or shaking, that's positive clonus, and it's not normal. Okay, I'm gonna get you to close your eyes for a moment, and you tell me where you feel me touch you.
Left leg. Right arm. Left arm. Right leg.
Okay, so sensation was intact in all of the extremities. Also, I forgot to mention his respiratory effect. His respiratory seems rhythmic. He's breathing effortless and it's quiet. And I'm gonna get you to sit again. I'm gonna check for your reflexes. So we're doing the patellar reflex. Okay. Good. Patellar reflex was active in both of the legs, and it was a +2. Oh, and I saved my favorite part for last, the eyes. One more time. Alright, conjunctiva is pink, sclera is white, and the cornea is clear. So that completes my physical assessment. I've lowered your bed in the lowest position. Your call light is within reach, and I've maintained HIPAA within this video. You have any questions?